A headline says existing drugs can block hantavirus. In a dish. That's a long way from something your doctor can hand you.
This is Hantavirus Watch. Today, the gap between a lab result and a prescription, and the incubation clock that runs out right about now.
The Hondius-Andes cluster, the treatment reality behind it, and what physicians are actually saying versus what the headlines imply. Let's walk it through.
Follow the show and the next briefing lands in your feed on its own. When I see a headline saying, researchers found drugs that can block hantavirus, I want to know, does that mean there's actually something doctors could give to someone who was on that cruise ship and got exposed?
That's exactly the right question, because blocks the virus in a lab and your doctor can prescribe it tomorrow are miles apart. Right now, there are no approved antiviral treatments for Andes hantavirus, full stop. Even though scientists have been working on this for decades, as NPJ Viruses and Chemical and Engineering News both reported this spring. Those promising headlines are usually about a drug repurposing screen. Researchers take a library of existing compounds, drugs already approved for other diseases, and test whether any slow hantavirus replication in cell cultures or animal models. A recent scientific report study did that with a related strain, Pumalavirus, and found 70 compounds with antiviral activity in lab cells, including inhibitors of heat shock proteins and the mTOR pathway. That's useful early science, but per Scientific American's reporting, potential therapies are still described as years away for humans, partly because hantavirus is so rare and dangerous that human trials are logistically and ethically complicated. Several research groups are also working on antibody treatments, but funding has been chronically short because, until the Hondius cluster, hantavirus didn't create the kind of public urgency that attracts big investment.
So if someone exposed on that cruise ship did get sick, what are doctors actually doing for them right now?
Supportive care, managing fluids, oxygen, and organ function is still the main tool because no targeted antiviral is approved. The Andes strain carries roughly a 38% mortality rate per ABC News' reporting, which is why researchers and public health officials are watching the funding piece so closely right now. This outbreak has given hantavirus a public profile it hasn't had before, and scientists are openly saying they hope to use that attention to push for investment that could move a therapy from a promising lab result into a human trial. If you or someone you know was on the Hondius and has symptoms, fever, muscle aches, or trouble breathing, contact a clinician or your local health department right away. Don't wait it out. From Austin Luttrell at Medical Economics.
Surveyed clinicians reported 85% perceived hantavirus coverage as exaggerated, while 77% rated population risk low/non-meaningful, and 62% observed increased patient questions. Most management centered on counseling. 89% prioritized explaining transmission, alongside reassurance about limited person-to-person spread and guidance to reduce rodent exposure.
So, Medical Economics, May 21st. It's a physician survey, and it puts clinicians' voices behind something we've been saying all week. 85% of surveyed clinicians called the hantavirus coverage exaggerated. 77% rated population risk low or non-meaningful.
Right, but the number I keep coming back to is 62%. Patient questions went up anyway. So doctors know the risk is low, and they're still fielding a waiting room full of worried people.
And look at what those doctors actually reached for. 89% said their counseling centered on explaining transmission and reassuring people about the limited person-to-person spread. That's where the Andes distinction matters, in the exam room with someone asking how this actually spreads.
Which lines up with the step back we just did. There's no approved antiviral sitting on the shelf, so the frontline tool is a doctor saying, okay, here's how you actually catch this thing. Counseling and rodent exposure advice. That's the intervention.
And on timing, today's July 1st. Anyone exposed at the beginning of the Hondius window in late May is now at or past the outer edge of that 6-week incubation ceiling. The cluster is basically over. The coverage has moved on. The treatment gap hasn't.
If you want more careful outbreak tracking, check out Measles Outbreak Daily, daily U.S. measles case counts, MMR vaccine policy, and outbreak updates for parents, teachers, and clinicians who want real numbers. Find it wherever you listen to podcasts. We've put links to today's stories in the show notes, so you can take a closer look at anything you want to follow up on. Thanks for listening, and take care. That's Hantavirus Watch for today. This is a Lantern podcast.